Hello dear students, this is Dr. Shaima Al-Gohari, lecturer of pathology. Today we are going to study pulmonary tuberculosis. Primary pulmonary tuberculosis is infection with TB infection for the first time or in person unexposed previously or unsensitized with vaccine exposed to the TB bacilli. About 5% of those newly infected persons develop significant disease in the form of three main pathologic forms or pathologic complex, what's called primary pulmonary complex. Primary pulmonary complex is composed of, first one, Ghon's focus. It's a focus of TB infection in the lung tissue, which is about 1 centimeter in diameter, small, rounded, consolidated area. Consolidated meaning it is a solid part, not spongy like other lung tissue. It's a solid part in the lung, which site will be base of the upper lobe or the upper part of the lower lobe, mostly subpleural in position with central caseation. Microscopically, as we previously studied, TB is a collection of epithelioid cells or macrophages, modified macrophages engulfing the organism, with some will form fusion to form a multinucleated giant cell Langerhans or foreign body type giant cell, and surrounded by a zone of small lymphocytes and fibroblast in the periphery. When the lesion develops, the central part of the granuloma will undergo caseation. Okay. Number 2 is a TB lymphangitis. Lymphangitis is inflammation in the lymphatic vessels by TB bacilli. It is chronically inflamed pedid lymphatic vessels. Okay. Third lesion will be TB lymphadenitis. So in primary pulmonary tuberculosis, we have a primary pulmonary complex. Complex is a aggregation of three features. First one, lobe, upper lobe or lower lobe of the lung. The apex of the lower lobe and the base of the upper lobe will show an area of consolidation. Solid part, small, rounded, subpleural. It's called Ghon's focus, with TB lymphangitis, inflammation of the lymphatic vessels draining this focus, and TB lymphadenitis in the draining lymph nodes of the lung. Draining lymph nodes of the lung, which are hilar lymph nodes. Okay. Primary pulmonary TB, again, there is a lung affection here. It's the apex of that lower lobe, subpleural focus, yellow, cheesy, cut section, rounded and subpleural. It's the base of the upper lobe. This here choose that to be in the apex of that the apex of the lower lobe, and that is a hilar lymph node affected by TB with caseation also. It's called TB lymphadenitis, and lymphangitis is not prominent here in this picture. Okay, this diagram, there is a focus here, subpleural, in the apex of the lower lobe or base of the upper lobe, with affection of the hilar lymph nodes by TB infection. Under a microscopy, as we've studied previously, this is lung tissue, okay, and there is a focus of infection with TB forming granuloma. Granuloma is formed of aggregates of foamy macrophages or epithelioid macrophages, like epithelial cells engulfing the organism, and some fuse to form multinucleated giant cell, and there is central caseation here with surrounding small lymphocytes and fibroblasts. Okay. What is the fate of primary pulmonary tuberculosis? Fate meaning the healing or the end result of infection with TB. Only 5% of patients will be symptomatized or significant disease. Okay. First fate occur mostly in 95% of the patient is fibrosis and complete destruction of the organism by the immune system, while a formation of fibrosis and calcification. That's called healed lesions. Okay, scarring in the Ghon's focus here, the base of the upper lobe, and scarring in the hilar lymph nodes that was infected by the TB. Okay. Or sometimes the infection couldn't be totally eradicated, and there is some bacilli living within that fibrotic focus called dormant focus. dormant focus or latent lesion, there is some organism remaining here, not pathogenic at that time, because the immune system can form fibrosis and can be against the organism. So the organism become dormant. Dormant يعني ساكن, okay, أو كامن. When the immunity decreased, the organism can cause reinfection and will take it in the secondary pulmonary tuberculosis. Okay. The third fate is a pulmonary complex which will progress into progressive pulmonary tuberculosis. Progressive pulmonary tuberculosis is not a common feature in primary pulmonary TB, as most of the patients, 95%, heal forming that calcific focus or the dormant focus. Okay, only 5% will enter in that progressive disease, which is called progressive pulmonary tuberculosis. Many foci of TB with caseation, extensive caseation. Some organism can reach the blood and forming what's called miliary TB and will take it in a diffuse way. Okay. Okay, what is the fate of primary pulmonary TB? 95% of cases with cell-mediated immune response will control the infection. Bones focus will undergo progressive fibrosis and calcification. Induction of hypersensitivity and increased resistance of the body will lead to more scarring of this focus and calcification with eradication of the organism. But in some cases, some organisms remain viable and forming what's called dormant focus. This dormant focus can be a source for secondary infection or undergo reactivation and forming secondary TB of the pulmonary TB. Okay, progressive pulmonary tuberculosis will occur in only immunocompromised individual and occur in 5% of that patients infected with the TB. Progressive primary pulmonary TB will occur in immunocompromised patients, like patients with a disease like HIV infected persons or malnourished children, elderly individual, or individual receiving immunosuppressed therapy. Okay, that resemble acute bacterial pneumonia with marked consolidation of the middle and lower lobes, become solid like liver, like with hilar lymphadenopathy, pleural effusion and exudation, with rare cavitation. Why there is rare cavitation? Yes, because the immune system is not well prepared to attack the organism at this way because they are immunocompromised. Okay, miliary TB in other organ and TB meningitis. Miliary TB will discuss it in details. Okay, secondary pulmonary TB. What's meant by secondary pulmonary TB? Secondary pulmonary TB is infection with TB for the second time. Second time, either it occurs shortly after primary TB or reactivation of that dormant focus as we said previously, or exposure to external infection from infected person. It's called reinfection from another infected person. Okay. Caused by reactivation of dormant bacilli in the dormant focus after decreased our immunity, it's called endogenous source of infection, or reinfection from TB bacilli exogenous from another infected person will infect me for the second time, and this organism will have a high virulence that can compete our immune system and form a lesion for the second time. What type of TB in comparison of primary TB and secondary TB? Infection in primary TB, it's infection for the first time, person not exposed previously to TB infection or not receiving vaccination. TB infection for the second time, it's reactivation of the dormant focus or secondary exposure to infected person. Commonly, primary TB occur in children, in endemic areas occur in children like in Egypt. Okay, person who not received vaccine still or not exposed to infected persons like children, or tourist جاي أول مرة يجي في endemic area وأخذ infection من endemic country. Okay, for secondary TB, it will occur in adult to receive the infection primary in his childhood and reinfection occur in his adolescence. Okay, site of the primary TB, as we said, Ghon's focus في primary will be subpleural in the lower lobe or the upper lobe, lower part of the upper lobe or apex of the lower lobe, and secondary TB it prefer to be in the upper lobes. Okay, apex of the upper lobe. Okay, spread to the lymph node mostly occur in the primary TB and less commonly occur in secondary TB due to localization of the infection with more fibrosis and more the scarring of the lung tissue. Tissue destruction and the cavitation, it will be much less in primary TB and increase in secondary TB due to hypersensitivity, as our body knows the organism and can destroy it and destroy underlying lung tissue, forming more caseation, more cavitation, more destruction of tissue. Okay, immunity. In primary TB, I have no immunity. I react with the TB with innate immune response, no memory to the TB as we didn't expose to it previously. In secondary TB, there is acquired immunity, hypersensitivity type 4 reaction. Okay. Okay. So in secondary TB, there is infection from external source like reinfection from infected person or endogenous source, activation of a dormant focus in decreased immunity of the affected person, forming secondary pulmonary TB, and the TB in this form will be affecting the apex of the upper lobe, causing large cavity which will progress to form multiple cavities in the lung. Rapidly, they undergo progressive secondary pulmonary TB, massive hematogenous dissemination, and miliary TB. Okay. What is the fate of secondary pulmonary TB? First, localized apical caseating lesion. With grossly, it will be a small focus of consolidation near the apex of the upper lobe, pleural phase. Okay, sharply demarcated, firm consolidation, solid area like Ghon's focus, but in the upper lobe and the apex of the upper lobe, will undergo caseation rapidly and peripheral fibrosis. First fate. Microscopically, coalescent tubercles, coalescent-like fused tubercles with a large central caseation. This caseation will undergo rapid cavitation and large cavity formation. In favorable cases, undergo progressive fibrosis and encapsulation. It's a good localization of the infection. Okay, or it may progress. The second form of fate of secondary pulmonary TB is progressive pulmonary tuberculosis with enlargement of that apical lesion and expansion to form many areas surrounding it. All these areas will undergo cavitation and caseation with erosion or destruction of the nearby bronchus, forming a ragged irregular cavity lined by caseous material and surrounded by fibrosis. That erosion of the bronchus may cause spreading of the TB infection into the nearby lung tissue, enter in that bronchus and spread into the smaller bronchi and bronchioles in the rest of the lung tissue. Or the lesion may erode blood vessel, resulting in hemoptysis, which is coughing of blood. Okay, if the patient received adequate treatment, the lesion will undergo fibrosis with irregular cavities and destroyed pulmonary parenchyma. If the treatment is not adequate and impaired defense mechanism of the body, the lesion will more disseminate through airway, through the bronchus, or through lymphatic vessels or blood. That apical lung lesion here, surrounded by areas of consolidation with yellowish cheesy cut section, more TB foci in the rest of lung tissue. There is a normal lung, that brown area, and all other areas are affected by TB. There are extension of that large cavity forming smaller cavities here. All these cavities will coalesce to form a large cavity with destruction of the underlying lung tissue. Okay, another case, smaller cavities here, areas of consolidation and caseation. All these lesions will undergo fusion, coalescence, and form large cavity. Under microscopy, Another granulomas, two granulomas here, formed of epithelioid cells, giant cells, and fuse together. All these two granulomas will fuse together, forming large cavitation and caseation inside. Okay, high power view, area of caseation. When the resistance of the body is decreased and the dose of the organisms that enter the body is increased, this leads to progressive pulmonary TB. Also, if the treatment is inadequate or the host defense are markedly impaired, the infection may spread by direct expansion or by dissemination. What about miliary TB? Miliary TB is a small TB foci that occur either in the lung or in other organs. In that lesion, there are large number of bacilli that enter the blood vessel, spreading into the blood, so the lesion opens in blood vessel. If that blood vessel is a pulmonary artery, it will spread into the lung parenchyma, and if the blood vessel is a pulmonary vein, it will reach the heart, and the heart will spread the organism to the aorta. Aorta will distribute the infection to various types of different organs. What about TB bronchopneumonia? There is large number of bacilli, but the lesion open into a bronchus. So when it open in the bronchus will spread the infection through the lung parenchyma, through the small bronchi and bronchioles. Miliary TB of the lung, there are small pinhead-sized foci affecting the whole lung parenchyma. That yellow, cheesy foci of consolidation. Under a microscope, there are small tubercles formed of granulomas with minimal caseation. Rest of lung tissue showed that compensatory emphysematous change. So, miliary TB occurs when the organism drained into vessel, either lymphatic vessel or venous return of the right heart into reaching the lung into the pulmonary artery, or when there is a pulmonary focus of TB that open into one of the branches of the pulmonary artery. So pulmonary artery will distribute, forming multiple branches into the lung, and each branch will deliver organism to one of the lung tissue, part of the lung tissue. It can follow either primary progressive pulmonary tuberculosis or secondary progressive pulmonary tuberculosis. Definitely, the patient in both primary and secondary have compromised immune response. Okay, receiving immune suppressing drug, or cancerous patient, AIDS patient. Okay, what's the main symptoms of pulmonary tuberculosis? Affection of the central nervous system in the form of loss of appetite and fatigue. It's one of the major signs of TB infection. So the patient have easy fatigability, loss of appetite, loss of weight, okay, with cough, productive cough, blood-tinged cough, okay, prolonged with chest pain, okay. Why central nervous system is affected in TB? Due to cytokine activation, due to activated macrophages, cytokine release as production of tumor necrosis factor and interleukin-1. Also, patient may complain of night sweat. So the patient have fever, night sweat, weight loss, loss of appetite, easy fatigability, cough, prolonged and blood-tinged cough. اوكي، زي الافلام كده زمان كان في حد بيكح كده في منديل يلاقي blood يعرف ان ده تي بي. اوكي، يبقى blood دي sign خطيرة. يعني ايه؟ يعني بدأ الانفكشن يوصل ل blood vessel ويعمله erosion، فيبدأ يحصل blood tinged cough. Okay, when blood vessel is eroded, so productive cough with blood tinged sputum. Okay, what are the complications of pulmonary TB? First, and the most common one, is hemoptysis, presence of blood in cough or in sputum. Okay, type. When the organism reaching the sputum and the patient is coughing, so TB can spread to the lung, oral cavity, and the lung, the tongue, forming tongue ulcer. Second organ is TB laryngitis, spread to the nearby covering pleura, because TB infection is mostly subpleural. Okay, so it's likely to affect the pleura, forming TB pleurisy. TB pericarditis is spreading to the nearby pericardium, spread to the pleura and the ribs outside, or reaching to the spine, forming what's called TB of the spine, or Pott's disease. Okay, it's an old name, Pott's disease, and common name. Okay, TB enteritis. Why it is caused? Due to swallowing of the sputum containing the organism. Okay, type. What is the long-term fate? Due to marked pulmonary destruction, fibrosis, decreased tributaries of pulmonary artery, what's called right-sided heart failure due to pulmonary fibrosis or pulmonary disease called cor pulmonale. Okay, because it is a long chronic specific inflammation, so the patient will have chronic toxemia leading to what's called amyloidosis. Amyloidosis is deposition of amyloid material mainly affecting the kidneys, forming what's called nephrotic syndrome. We'll discuss it in details in renal system. Okay, spread to other organ like miliary TB of the organs, in the brain, in the liver, in the spleen, okay, and so on. Okay, to summarize, TB infection either primary or secondary. What's meant by primary? Primary TB is infection for the first time in person not sensitized, not infected previously by TB. Mostly in endemic areas it occurs in children. Okay, طيب لو أنا مش endemic area ممكن يحصل في أي age. Okay, or endemic area with one first time to visit that country like tourist. Okay, ممكن يجيله في الادلت، يبقى commonly in young age children, rarely in adults. Okay, طيب what is the fate of primary TB? 95% of the patient will heal, okay, forming what's called fibrosis and calcification, what's called healed lesion. Okay, some percent of the patient may undergo what's called dormant focus. Dormant focus is calcification and fibrosis, but no complete eradication of the organism. There is minimal organism still alive, but dormant. Dormant means that its virulence decreased and the immune system of the body is taking the upper hand. Okay, 5% of the patient or minimal degree of the patient may undergo into complication in primary TB, forming what's called primary progressive pulmonary tuberculosis. Okay, and miliary TB in organs and in the lung. Okay, what are the causes of secondary pulmonary TB? It's infection for the second time, new infection from infected person. Okay, so it is called exogenous source, or it may be activation of that dormant focus. Why it is activated? Because the body resistance decreased. Patient become immunocompromised, receive therapy, have diabetes, and so on. Okay, يبقى either it is endogenous source due to reactivation of dormant focus, or another reinfection from infected person, it's called reinfection or exogenous source. Okay, in the secondary TB, the immune system have memory to attack the organism. So the immune system will destroy the organism rapidly, forming much more cavitation. That cavity may progress and spread into rest of the lung tissue. Okay, marked destruction, caseation, okay, may affect pulmonary and extrapulmonary areas, or it may progress to progressive secondary pulmonary tuberculosis and miliary TB either in the lung or in different organs. Okay, thank you.